Logo, BAME Vision. Good evening and welcome, and thank you for joining us today at our third BAME Vision workshops around National Eye Health Week. And if you did miss the other two sessions on Monday and Tuesday evening, we shared what National Eye Health Week is, an introduction to BAME Vision, who we are, why we are, and what our aims and objectives are. You met a couple of our team members. You met the Vice Chair, Adam Mapani, Tricia Smykel, Salia Rashid, who are committee members. You met Dr. Sheena George, who delivered a fantastic presentation on Tuesday around diabetes and common eye conditions prevalent in our communities, and in particular as well over the age of 60, and translated by that from our committee member Subhash Sattar, who's joined us today. And we heard from Nita Patel with her experience of living with diabetes and how she's, she gave us tips and her personal journey about management. So we are covering this themes around National Eye Health Week, and today's session is called Live Well and See Well. And what that is we're going to be sharing information about why it's important to get your eyes tested. When you get your eyes tested, what can actually be detected? So, we often think that we're going to the optician, we're getting our eyes tested, but actually there's so much more that can be found out by just looking into our eyes. We'll be sharing who's eligible for a free eye test. And I don't know how many people knew, actually, certain people are eligible for home visits. So I'm Bhavini Makwana, the chair of BAME Vision, and I'm also the speaker today for the lived experience section, where I'll be talking about living with retinitis pigmentosa, my diagnosis, being a vision impaired mom, and some of the barriers that I've overcome. And we'll also be discussing some of the myths around certain so-called remedies that we've heard along the way, extracting juice from certain vegetables, fruit, and animals to either drink or insert into our eyes. So we'll be really informing what actually is right and what is wrong. And there'll be a section to ask any questions that you may wish to. And that is a point where you can unmute if you so wish, or you can put your questions in the chat, and they are being monitored. So they will be sort of read out on your behalf. So I'd like to introduce both of our committee members, Jayshree Vasani, who's a dispensing optician, and Subhash Sattar, who is a clinical application specialist. So please, both of you, do introduce yourselves, and over to you.
Thank you, Bhavini. That's a great introduction. And I'm just going to share my screen, if that's okay, and try and get myself on there. If I get to be the host. Let's see if that works. I'm the host now. All right, let's see where that goes. Oh, Hina Lad is the host. No, don't want that. BAME Vision is the host. Right, let's see if I can be the host. Let's see. Jolly good. I'm the host. Great. Okay. So welcome to this session on eye health, and let's have a little look and see where we are. So this session is all about eye health, and what we're going to do is cover eye health and talk about the importance of an eye test. My name is Jayshree Vasani, and my colleague with me today is Subhash Sattar. So let's see what it's all about. Let's see whether I can get this to work. All right. Right, so that's a little video that's going back and forth. They put a little lens in front of your eye and it gets clear. And then if they take the lens away, the vision goes blurred again. All right, so here we go. So we're going to do a little introduction first. As I said, my name is Jayshree Vasani. I'm a dispensing optician. Subhash, do you want to introduce yourself?
Yeah, I'm Subhash Sattar. I'm actually pharmacist by training, but I've always worked in clinical and therapeutics applications. And I work with my colleague here, Jayshree Vasani. Bhavini, of course, and we have been very fortunate to create this BAME Vision to at least pass on the message to the community.
Yeah, absolutely. So we're both members of the BAME Vision group. We know that BAME is Black, Asian, and minority ethnic, and the idea of the group is to reach and engage with local communities to highlight the importance of looking after your eyes, okay, attending eye test appointments, taking precautions to maintain the eye health and make sure that we're looking after our eyes. We are passionate about eye health, really, and all the people that sit on this committee are all passionate about that. A few of us have won awards all the way through, but winning awards is one thing. What we want to do is take action, and that's what this week's all about, really. It's about making sure that people are not losing their sight every day in our communities. So that's the key thing for us. That's what brings us together. So let's see how big the problem is, okay? So we have 2 million people in the UK living with sight loss, 2 million people, okay? And that sight loss is enough to make a difference to an impact to their daily lives, to everything, every single thing they do, from making a cup of tea, to opening their post, to talking to people on the phone, to watching TV. All of these things, okay, have a massive impact if your vision is not good. The important thing to remember here is half of that sight loss is preventable, okay? And we can change this by having an eye examination and getting our diagnosis early, by making changes in our diet, in our environment, and in our lifestyle, and by raising awareness in our communities. So do you want to do a little bit of that in Gujarati? You're better than me.
ગુજરાતી આપણા અહીંયા યુકેમાં લગભગ 2 મિલિયન પીપલ છે જે લોકોની દ્રષ્ટિ નથી અને they live sightless, એટલે દ્રષ્ટિવિહીન માણસો છે. સાઇટ લોસ સિગ્નિફિકન્ટ એટલા માટે કહેવાય કે આપણા આખા જો આપણે જો જોઈ ના શકીએ તો આપણા જે ડેલી રોજની જે કાર્યક્રમ છે, આપણે જે સવારથી ઉઠીને સાંજ સુધી જમવાનું, નાવા ધોવાનું, ઘણી બધી વસ્તુ એમાં ઇન્વોલ્વ થાય. અને જો આપણી દ્રષ્ટિ ના હોય તો એમાં ઘણું બધું પ્રોબ્લેમ્સ થાય અને અટકન થાય. એકચ્યુઅલી દ્રષ્ટિ અડધો વખત તો છે ને એને બચાવી શકાય, એટલે પ્રિવેન્ટેબલ છે, કે જેને સાચવી શકાય છે. એની આપણે there is a treatment available, એ બી બધું થાય. અને we can change this, આપણે આ બધું બદલી શકીએ છીએ કઈ રીતે, કે by having regular eye examination. જે જયશ્રી કહ્યું, આંખોની તપાસ કરાવવી આપણા ઓપ્ટિશિયન પાસે એ બહુ જ જરૂરી છે. અને જેટલી વહેલી આપણે આંખોની તપાસ કરાવીએ એટલી વહેલી એની કાળજી લઈ શકાય. અને આપણે આપણા ખાવામાં, આપણા ડાયટમાં, આપણા ખોરાકમાં, આપણી આજુબાજુમાં એન્વાયરમેન્ટ, આપણે કે આપણી લાઈફસ્ટાઈલ, આપણે બેઠાડું જીવન, અત્યારે પેન્ડેમિકને કારણે બધા ઘરમાં ભરાઈ રહ્યા હોઈએ છીએ, છતાં પણ બહાર નીકળીને ગાર્ડનમાં બી આંટા મારી શકાય, ઘરમાં પણ ચાલી શકાય. એટલે ઘણી બધી વસ્તુ આપણે કરી શકીએ. આ BAME કમિટી જે ઓર્ગેનાઇઝ થઈ છે અને જે અમે બધી ભેગા થઈએ છીએ, ભેગા થઈને આ બધી જુદી જુદી પ્રક્રિયાઓ આપણને કેવી રીતે મદદરૂપ થઈ શકે એ માટે અમે આ અવેરનેસ, એટલે કોમ્યુનિટીમાં જઈ અને આ સંદેશો અમે પહોંચાડીએ છીએ. જયશ્રી.
Thank you. So eyes are the windows to the soul and to your health. Okay, that's what people say. And the reason for that is that with eyes, when an optometrist looks at the back of your eye, that's the only place in the whole body they can actually see your blood vessels live. Now, if you want to see your blood vessels anywhere else, you have to cut your skin. But in your eye, they can actually see the blood vessels in your eyes, and from that, they can pick up so much stuff. If the vessels are large or too small or leaky or whatever's going on, all of those little very early signs of disease and eye conditions can be picked up just by somebody who's trained to look at your eye, can actually look at your eye. So it's a very important piece of the jigsaw that people need to know, that's what they can pick up by looking in the back of your eye. And there are so many conditions they can pick up by looking at the back of your eye. So let me just go forward. So Suresh, do you want to do that bit or?
I can do that.
Yeah.
આપણો આંખનો ટેસ્ટ શા માટે બહુ ઇમ્પોર્ટન્ટ છે? અને જેમ જયશ્રી હમણાં જ કહ્યું કે આંખો આપણી છે ને આપણા આત્માની અંદરની શારીરિક બધે આમ વિન્ડો આપણે બારી છે. આંખો એક એવી બારી છે કે જેને જો આપણે અંદર આપણે જોઈએ અંદર તો જેમ રક્તવાહિનીઓ છે, આપણે બ્લડ વેસલ્સ છે. આપણને બ્લડ વેસલ તો સ્કિન ઉપર પેલી ચામડી પર ત્વચા પર દેખાય પણ છે, પણ આંખોમાં જોવાથી પાછળના જે રક્તવાહિનીઓ, જે કેપિલરીઝ ને બ્લડ વેસલ્સ છે, એના પરથી ઘણું બધું તારવી શકાય. ઘણા બધા ડિઝીઝ, ઘણી બધી જે શરીરમાં જે બધું થઈ રહ્યું છે એ બધું શોધી શકાય. બીજી સ્લાઇડમાં જે હવે આવશે એમાં આપણે બતાવી શકીશું. We'll be able to show that.
Yeah. So why are eye tests so important? So the onset of many health conditions are very gradual. Okay. So people don't realize they have that condition until it's too late. Okay. So for example, glaucoma, that's when a person could be losing part of their peripheral vision, the side to side vision. Okay. But because we have two eyes, we don't always notice it until it's too late. Okay. Now that vision loss is irreversible. You can't get that vision back. Okay. So having a full eye checkup for your eyes not only tests your vision, but it can pick up early signs of things like diabetes, high blood pressure, cholesterol, age-related macular degeneration, glaucoma, retinitis pigmentosa. This is just a few examples, okay? And this is why for the diabetes side of things, the diabetic screening that you have done once a year is vital to attend. Subhash?
આંખનો તપાસ શા માટે જરૂરી છે? એ એટલા માટે જરૂર છે કે આંખમાં જોયા પછી આપણે જ્યારે ઓપ્ટિશિયન પાસે જઈએ અને જ્યારે આપણે આંખમાં એ જુએ તો એમાં ઘણું બધું શોધી શકાય છે. ફોર એક્ઝામ્પલ, ઘણી વખતે શું થાય છે કે આપણી દ્રષ્ટિમાં કઈ ફેરફાર થયા હોય એ આપણને ખબર નથી પડતી. જાણ્યું કે ગ્લોકોમા આપણે ગુજરાતીમાં ઝામર કહેવાય, હિન્દીમાં એને કાલા મોતિયા કહેવાય. હવે આમાં આંખની અંદર પ્રેશર વધતું જાય અને ધીરે ધીરે થઈને બાજુની દ્રષ્ટિ આપણી સાઈડ વિઝન, બાજુની દ્રષ્ટિ ધીરે ધીરે ઓછી થતી જાય. પણ આપણું એક તો મગજ ફિલિંગ કરે અને બે આંખો છે એટલે એ કોમ્પન્સેટ કરે, એકબીજાને ભેગી કરી અને જોઈ શકાય. એટલે આપણને ખ્યાલ જ ના આવે કે આપણી દ્રષ્ટિ ધીમે ધીમે ઓછી થતી છે. ત્યાં સુધી મોડું થઈ જાય ત્યાં સુધી. અને ત્યારે ખબર પડે આપણે જ્યારે ઓપ્ટિશિયન પાસે જઈએ, જ્યારે અંદર જુએ ત્યારે ખબર પડે કે અંદર આપણી પાછળ રેટિનામાં કે આપણે દ્રષ્ટિપટલની અંદર ફેરફાર થયા છે. એક વખત આપણી દ્રષ્ટિ ખોવાય તો પાછી કદી આવી શકે નહીં. ફ્યુચરમાં કદાચ બનશે, જેનેટિક વગેરે રિસર્ચ ઘણું બધું થયું છે કે રેટિના આપણી જે દ્રષ્ટિપટલ છે એની રીગ્રોથ કરવાની, એને નવા બનાવવાની અંદરથી, એ બધું પણ બહુ દૂર છે. મોસ્ટ ઇમ્પોર્ટન્ટ ખાસ જરૂરી કહેવાનું એ કે આંખોની તપાસ કરાવવી બહુ જરૂરી છે. અને ખાસ કરીને ડાયાબિટીસ માટે. ડાયાબિટીસનું જે હોય છે એમને બધાને ખબર હશે કે વર્ષે દિવસે ડાયાબિટીસ સ્ક્રીનિંગનું આવે છે. ચૂક્યા વગર જરૂરથી જવું બહુ ખાસ જરૂરી છે, કારણ કે એમાં બધું જ ખબર પડે કે એ લોકો પ્રેશર છે, કોલેસ્ટ્રોલનો છે, પાછળ રેટિનામાં ફેરફાર થયો છે, દ્રષ્ટિમાં કઈ ફેરફાર થયો છે. આ બધું જ ક્યારે પકડાય? તમે તમારા ઓપ્ટિશિયન પાસે રેગ્યુલરલી એટલીસ્ટ 2 વર્ષે એક વાર તો જરૂર જઈને આંખો ચેક કરાવવી બહુ જરૂરી છે. જયશ્રી.
Thank you, Subhash. So this is a list of the conditions that can be picked up during a comprehensive eye examination. And you can see things there like it says age-related macular degeneration, an aneurysm, a brain tumor, diabetes, glaucoma, lupus, stroke, Lyme disease, multiple sclerosis, rheumatoid arthritis, retinitis pigmentosa, Sjögren syndrome, thyroid disease, and vascular disease like Alzheimer's disease. So there's lots and lots of conditions here that can be picked up. The important thing is you go for an eye test every 2 years and sooner and more frequently if your optometrist says. Subhash?
આ સ્લાઇડમાં બધા કેટલા બધા ડિઝીઝના બધું લિસ્ટિંગ થયું છે. અને બધું હવે એજ રિલેટેડ આપણી સોસાયટીમાં, ખાસ કરીને એશિયન કોમ્યુનિટીમાં એજ રિલેટેડ મેક્યુલર જનરેશન એક ખાસ વધારે પડતું આવે છે. ગ્લોકોમા બીજી કન્ડિશન છે, કેટરેક્ટ અનધર કન્ડિશન છે, ડાયાબિટીસમાં પાછળ જે ફેરફાર થાય છે એ ઘણું થાય છે. બાકી તો સ્ટ્રોક છે, લુપસ છે, ઘણું બધું, રૂમેટોઇડ આર્થરાઇટિસ છે, રેટિનાઇટિસ પિગમેન્ટોસા છે, શોન્સ સિન્ડ્રોમ છે. આ બધું ક્યારે પકડાય? જો તમે રેગ્યુલર આઈ ટેસ્ટ માટે જતા હો. ખાસ કરીને એટલીસ્ટ બે વર્ષે એકવાર તો જવું બહુ જ જરૂરી છે. એવું નથી કે તમને ચશ્મા પકડાવી દેશે ત્યાં આગળ. આ ટેસ્ટ કે તે બધું જે અંદર જોઈને જોઈ શકાય કે કઈ ફેરફાર થયો છે કે નહીં, અને જો ફેરફાર થયો હોય તો કેટલી જલ્દીથી એની આપણે સારવાર લઈ શકીએ. જયશ્રી?
Yep. So why do people not go for an eye examination, for an eye test? This is something we thought long and hard about. And we worked with a group called COVID-19 Infographics. And what we created, they're a group of medical students and doctors and volunteers, and they create what are called infographics. Now, if you don't know what an infographic is, I'm going to show you. The next slide will be one. But it's like a poster, and it helps to summarize key points about this one's about COVID-19, and they translate this information in easy to understand in different languages. Because what's happened is over the COVID-19 pandemic, people have been sharing all sorts of messages over WhatsApp with your family groups, with your friends, with your communities. And sometimes the messages are correct, and sometimes the messages are not correct. Sometimes people send wrong information. So as a group of doctors and medical students and volunteers, they thought it was important for the right information to come through, but also in different languages. So I think that we translated these resources in something like 19 different languages across the social media, and they got shared, right across, all over the world, really, because they did go as far as on LinkedIn and places like that. Subhash?
આપણે આંખની તપાસ માટે કેમ જતા નથી? અને એ ખાસ કરીને જ્યારે પેન્ડેમિક અને લોકડાઉન શરૂ થયું ત્યારે આ ખાસ ધ્યાનમાં આવ્યું કે એક તો ઘરમાં જ છે, જતા નથી, અને ઉપરથી વોટ્સએપ અને એટલા બધા જાતના સમાચાર આવવા માંડ્યા એની ઉપર, અને ઇન્ફોર્મેશન આવવા માંડી કે ભાઈ આમ થાય ને તેમ થાય ને. અને ઘણી વખતે સાચું બી હોય છે, ઘણી વખતે મોસ્ટલી તો ખોટું પણ હોય છે. એટલે એક આખું ગ્રુપ ભેગું થયું ગયા વર્ષે, અને એમાં એ ગ્રુપમાં COVID-19 ગ્રુપ કરી, અને એમાં મેડિકલ ડોક્ટર્સ છે, સ્ટુડન્ટ્સ છે, વોલન્ટિયર્સ છે, જયશ્રી, હું પણ ઇન્વોલ્વ છે અંદર. અમે બધાએ ભેગા થઈ અને એક આખા પોસ્ટર્સ બધા ક્રિએટ કર્યા. આ પોસ્ટર અવેલેબલ છે ફ્રી, અને 19 થી 20 ભાષાની અંદર એનો તર્જુમો કરેલો છે. એટલે તમે ગુજરાતી હો કે હિન્દી બોલતા હો કે ઉર્દુ કે બેંગોલી, તો તમને, ઓર ઇવન સ્પેનિશ ઓર ફ્રેન્ચ, સ્વાહિલી, યુ નેમ ઇટ, અને આ બધી જ લેંગ્વેજીસમાં બધી જ ઇન્ફોર્મેશન એ પોસ્ટરમાં છે. અને પછી હમણાં જે બીજી સ્લાઇડ આવશે એમાં બતાવવામાં આવશે કે તમે યુ કેન એક્સેસ ઇટ. આ તમને જો જરૂર લાગે તો BME અમારે કમિટીમાં જેમ ઇન્ફોગ્રાફિકમાં, એટલે info@BME ગ્રુપમાં કરજો, તો ત્યાંથી ઇન્ફોર્મેશન મળશે, અથવા તો ડાયરેક્ટલી પણ મળી શકશે.
Thank you, Suresh. Okay, so this is one of the infographics, and this one is called Mythbusters. So when we talk about an eye test, people have so many things in their head that they're thinking about of why not to go, reasons why not to go. Okay, so one could be, my eyesight's fine, so why do I need to have an eye examination? Okay, and we've just said earlier on in the presentation that sometimes things take a long time to come through. So the idea is to catch things early. Okay, so when you have an eye test, we want to try and catch things early, not when things are not so well. And diseases can come off, gradually. So Bash, the next one is the puff of air test.
Sorry,
the puff of air test scares me.
I just lost my screen. So
that's okay. I'll read it out.
Okay.
So
now I got it back. Got it back.
Okay.
મેઇન તો શું થાય છે કે આપણે જ્યારે ઓપ્ટિશિયન પાસે જઈએ છીએ ને, તો ઘણી વખતે મેં સાંભળ્યું છે બધા પાસે, એ મારી આંખમાં પેલી હવાનો ઝોકો મારે છે, અને મને એનાથી બહુ ડર લાગે છે. પણ એકચ્યુઅલી ખરી રીતે તો છે ને, એ બહુ જ સિમ્પલ અને બહુ જ સીધી રીતે ને બહુ જ સાદી એક ડાયગ્નોસ્ટિક, એટલે તપાસ કરવાની રીત છે, જેમાં તરત જ એ જે પેલું પ્રેશરથી આંખ દબાઈને પાછી આવે એમાં આખું રીડિંગ આવે, એટલે આંખમાં પ્રેશર શું છે, આપણે બ્લડ પ્રેશરમાં નથી હાથમાં પેલું બાંધીને હવા ફૂલીને કરે છે. આ બીજો પ્રકાર છે. હવા આંખમાં નાખી અને જે પેલું મશીન છે એનું રીડિંગ લઈ લે અને આંખમાં શું પ્રેશર છે એ બતાવે. ડરવાની કોઈ જરૂર નથી.
Yeah. So Subhash is right in saying that the puff of air test isn't anything to worry about. It is quite painless. It just checks the pressure of your eye. And this can help when we're trying to figure out whether a person has glaucoma. Generally, if you're scared of that test, please tell the optometrist, tell them you're worried about it, and they will demonstrate it on your hand. They will show you what's going to happen. And generally only lasts a couple of seconds. And that's really important. If they get the pressure and they have a baseline, they can monitor that. And it's worth that, that little bit of discomfort, maybe, if you think about it. Now, if I wear glasses, my sight will become worse. Somebody said that to me the other day. And I said, well, your vision will become sharper and your eyes will feel more comfortable with the glasses. But it's up to you. If you don't want to wear them, it's your choice, right? Because you're the grown up. So and your brain recognizes that if they put the glasses on, you can see better, you can see more comfortably, and there's less eye strain. Okay, all right. Next one. The eye test will only be able to tell me about my eyes and not my general health. But we've done that one already because we know that it can pick up things like diabetes, high blood pressure, and glaucoma. Now, this is important. With the COVID situation, we said, if I go to A&E due to my eye examination, to an eye problem, will I catch COVID-19? Subhash, this was one that we picked up quite a few times, didn't we?
Absolutely. છેલ્લા વર્ષની અંદર અમે લોકો રેડિયો સ્ટેશન પર બી વાત કરી છે, ન્યૂઝ સાઉન્ડ રેડિયો પર, બોલ્ટન હિન્દુ ફોરમ પર જે ગયા છીએ, બીજા રેડિયો સ્ટેશન ઉપર બી વાત કરી છે. અને કાયમ આ ક્વેશ્ચન આવ્યો છે, કાયમ આ સવાલ આવ્યો છે કે મને મારી આંખમાં જો પ્રોબ્લેમ થાય છે મને, તો હું એનીમાં જઈશ ને મને કોવિડ લાગી જશે તો? ના, એ ભ્રમણા ખોટી છે. કારણ કે બધા એએનઈ બધી જ હોસ્પિટલમાં પીપીઈ એટલે જે બધા કોવિડની અગેન્સ્ટના જે સ્વચ્છતાના બધા જે આખા જે રૂલ્સ ને બધું રેગ્યુલેશન્સ બધા છે, એ તમે જેવા હોસ્પિટલમાં અંદર એન્ટર થાવ એટલે એકદમ બધું જ ક્લિયર કોવિડ ના થાય એના બધા સ્ટેપ્સ લેવાના, બધા જ એ લોકોએ તૈયાર રાખી છે. એટલે ગભરાવાની કોઈ જ જરૂર નથી. અને જો કંઈ આંખનો પ્રોબ્લેમ થયો હોય ને એનીમાં જવું પડે તો પ્લીઝ તમને બધાને પ્રાર્થના છે કે યુ મસ્ટ ગો વિધાઉટ ફેર.
Yeah, thank you. If I go for an eye examination, eye test, I will end up wearing glasses. That's not necessarily true. An optician is trained to decide whether you need glasses or not. But again, you're the grown up. You can decide what you want to do. Okay. If you feel you don't want to wear the glasses, that's your choice. You can see better with them and it's up to you. Okay. What if I get the answers wrong during the eye examination? So let me just tell you, there is no wrong answer. Okay. I know that sometimes people ask you, they say, is it better this way? Is it better this way? There is no wrong answer because the optician will use other tests to check your vision to see if the prescription is correct. Okay. If you're ever unsure, just ask the optician or the optometrist to repeat something again if you're unsure. Just to ask them to take their time and repeat. It's fine. I'm scared of having an eye test. I don't want to be told I have an eye problem. Subhash?
અને આ બહુ જ આ પણ અમે 2-3 વખત ક્વેશ્ચન છે ને, 2-3 વખતની ઘણી વાર આ ક્વેશ્ચન આવ્યો છે કે હું ઓપ્ટિશિયન પાસે જઈશ તો મને મારું શું દર્દ છે, હું શેનાથી સફર કરું છું, મને કંઈક પ્રોબ્લેમ છે નહીં, મને સ્ટ્રોક છે કે મને રેટિના પર આપણે ડાયાબિટીસનો પ્રોબ્લેમ છે. પણ ખરી રીતે તો આઈ ટેસ્ટ એટલા માટે જરૂરી છે કે તમને જો કંઈક પ્રોબ્લેમ હોય, શરીરમાં કંઈ પણ પ્રોબ્લેમ હોય તો સૌથી વહેલો પકડાઈ જાય. જો વહેલો પકડાય તો એની ટ્રીટમેન્ટ, એની સારવાર જલ્દી થઈ શકે. આપણે મેં ના કહ્યું કે આ ગ્લોકોમામાં આપણે ના જઈને ગ્લોકોમા વધી જાય અને આપણે એટલે ઝામર વધી જાય, પાર્શિયલ વિઝન આપણું બાજુની દૃષ્ટિ વિહીન થતા જઈએ, ખબર પડતી ના હોય અને પછી અથડાઈએ, પડી જઈએ, વાગે, ત્યારે આપણને લાગે ના હું ઓપ્ટિશિયન પાસે જો વહેલો ગયો હોત તો અમારી ટ્રીટમેન્ટ વહેલી જ થઈ શકી હોત ને મારું આ જે અંધત્વ જે પ્રોગ્રેસિવ થાય છે એ રોકાઈ ગયું હોત. એટલે બહુ જ ચિંતા કર્યા વગર આઈ ટેસ્ટ કરવો બહુ જ જરૂરી છે. હું મારો પોતાનો દાખલો આપું. હમણાં 2 અઠવાડિયા પહેલા જ હું તો રેગ્યુલરલી ચશ્મા પહેરું છું. 2 અઠવાડિયા પહેલા જ જઈને મારો આઈ ટેસ્ટ કરાવ્યો અને વી ફાઉન્ડ એવરીથિંગ ઇઝ ક્લિયર. બધું જ ક્લિયર છે. ખાલી થોડો નંબર એકચ્યુઅલી તો નંબર ઓછો થયો છે. સો આઈ ગોટ માય ગ્લાસીસ એન્ડ આઈ એમ મચ કમ્ફર્ટેબલ નાઉ. બહુ સુંદર રીતે અત્યારે હું આટલો દૂર બેસી અને બધું જ હું સ્ક્રીન ઉપર વાંચી શકું છું, જે 2-3 અઠવાડિયા પહેલા આઈ વોઝ હેવિંગ પ્રોબ્લેમ્સ. એટલે ચિંતા કર્યા વગર આઈ ટેસ્ટ કરવો બહુ જ જરૂરી છે, અગત્યનો છે. જયશ્રી?
Subhash just told everyone that he'd been for his eye test 2 weeks ago. He was struggling with his screen, and now he's got some new glasses and he can see them much more comfortably. I translated back, Subhash. How about that?
Brilliant. No,
Okay.
it's true.
Yeah, absolutely. Can my child have their eyes tested even though they cannot read the letters? Or can my mum or dad who can't speak very good English have their eyes tested? The answer is yes. Most opticians are able to test children aged over 5. If the child is young, and and they can't take the letter, you can't do the younger than that, and they can't do the letters, then you should speak to the GP about your child's eyes. And if it's somebody older, there's we can use different charts for different people. If they don't know the letters or the numbers, you can test the vision in a different way. So don't worry about that. We can sort that out. And the last one is, if my vision is bad and I drive, and I continue to drive, will my optician report me to the DVLA? Okay, so the optician will advise you on the visual requirements for driving. Okay, it's your responsibility to report to the DVLA any medical or eye conditions that affect your eyes. But the difficulty is that people say, oh, I won't go far, I'll just go locally. I don't drive very far. I know my vision is not very good, but I don't drive very far. The difficulty is you might not drive very far, but you can still knock somebody over because you didn't see them and kill them. That isn't something you want to, have on your sort of desk, if you like. Subhash?
છેલ્લા મારા 10 વર્ષનો એક્સપિરિયન્સમાં આ ઘણી વખતે મને આવ્યું છે, અને આઈ કમ એક્રોસ ધીસ. લોકો એમ કહે છે કે મારું વિઝન ઇટ્સ ઓલ રાઈટ, વાંધો નહીં આવે, હું તો થોડું મારું ડ્રાઇવિંગ, મારું વિઝન જો ખરાબ થઈ ગયું હશે, મારી દ્રષ્ટિ ખરાબ થઈ હશે, તો મારું લાયસન્સ જતું રહેશે. હું તો ખાલી સુપર માર્કેટ સુધી જ જઉં છું, ખાલી મારા જીપી પાસે જ જઉં છું. એટલે પણ બે વસ્તુ છે. એક તો જો તમારી આંખોની દ્રષ્ટિમાં પ્રોબ્લેમ થયો હોય અને જો એક્સિડન્ટ થયો, તો તમારું ઇન્સ્યોરન્સ પણ એકચ્યુઅલી તો they will not pay for your insurance. It's a fact. બરાબર? અચ્છા, બીજું એક વસ્તુ છે કે તમને ગ્લોકોમા હોય, એક આંખમાં હોય અને બીજી આંખ ક્લિયર હોય, તો DBLA ને જણાવવાની જરૂર નથી. પણ બંને આંખોમાં જો ગ્લોકોમા હોય, તો તમારો ઓપ્ટિશિયન અને તમારો ઇવન હોસ્પિટલમાં ઓપ્ટોમેટ્રિસ્ટમાં ડોક્ટર તમને સલાહ આપે કે તમારે DBLA ને જણાવવું જોઈએ. એક વખત તમે DBLA માં જણાવો, તમારું લાયસન્સ જતું નહીં રહે, એ તમને ફર્ધર ટેસ્ટ માટે સ્પેક સેવર્સ છે એમાં મોકલે અને એમાં ટેસ્ટ થાય. અને મેં જોયું છે કે 80% ઓફ ધ પીપલ ડુ નોટ લૂઝ ધેર લાયસન્સ. અને ખરી રીતે તો જો આપણને લાગે કે આપણી દ્રષ્ટિ ઓછી થઈ ગઈ છે, તો આપણી સેફટી અને લોકોની સેફટી માટે ડ્રાઇવિંગ બંધ કરવું બહુ જ જરૂરી છે. જયશ્રી?
Okay. So, top tips for an eye test, okay? What should we do when we go for an eye test? Always take a list of your medication, because that's useful. People, the optometrist will need to know that. Always tell the optician or the optometrist before you come for the eye examination if you have any conditions that they need to know about. So if you're taking your parent maybe and they have a hearing problem or they have dementia, when you book the appointment, tell them that so they can book a longer appointment time. Okay, if a person with a learning disability, they may need extra time for the appointment, so they don't feel rushed. It's a comfortable eye examination. Okay, and like I said, people worry about patients that can't read. There's lots of different ways of accessing that. As a carer, you need to highlight any sign of change of behavior. You're spending time with that person all the time. If you are looking after your parents, if you're the carer and looking after your auntie or uncle, and you notice that they're a bit isolated, they're not talking so much, they keep bumping into things, you must tell the optician or the optometrist that tell the optometrist when they're having the eye examination. And the other thing is that if a person has a disability, sometimes patients have other disabilities, it's important that the optician knows that that's not the problem at the moment. So that's called diagnostic overshadowing. So this is when a healthcare professional assumes that a patient's disability problem is due to their disability rather than exploring the full cause of what's happening. Okay, so it's important that the carer actually tells the optometrist their concerns about the patient. Okay.
Oh, I give up. Just keeps cutting out.
Ooh, I heard somebody's voice there.
Yeah. Okay.
Carry on, it's okay.
Subhash?
Yeah. એકચ્યુઅલી તો આ સ્લાઇડ બહુ પરફેક્ટ છે ખરી રીતે, કારણ કે જે 2 અઠવાડિયા પહેલા હું ટેસ્ટમાંથી ગયો હતો, આજકાલ તો શું થાય છે કે તમે એપોઇન્ટમેન્ટ બુક કરો ને એટલે હું આ સ્પેક્સ વાળો તમને દાખલો આપું છું, તો એક આખું ફોર્મ ભરવાનું હોય છે. એમાં જે જયશ્રીએ બધું બતાવ્યું ઉપર એમાં બધું લખેલું છે. એક તો લિસ્ટ ઓફ મેડિકેશન, તમે જો સપોઝ હાર્ટ પ્રોબ્લેમ હોય, હાર્ટની મેડિસિન લેતા હોય, કિડની માટે ડાયાબિટીસની મેડિસિન લેતા હો, એ બધી મેડિસિન તમારે લિસ્ટ કરવી પડે ત્યાં આગળ, એટલે તમને ઓપ્ટિશિયનને ખબર પડે. બીજું બીજી કોઈ કન્ડિશન હોય કે આપણે સાંભળવામાં કંઈક પ્રોબ્લેમ હોય કે થોડું ડિમેન્શિયા આપણે ભૂલી જતા હોઈએ, એ પણ ઓપ્ટિશિયનને બતાવવું જરૂરી છે. એ શા માટે કે આ બધું જાણ્યા પછી એ લોકો આપણું કેવી રીતે તપાસ, કેવી રીતે આપણને સુટેબલ થાય, ઇન્ડિવિજ્યુઅલને પોતાને માટે કેવી રીતે સુટેબલ થાય એ બધું જોઈ શકે. બીજી ડિસેબિલિટી બી હોય છે ને, ઘણા માણસો ચાલી નથી શકતા, વ્હીલચેરમાં જતા હોય છે, પણ આ બધી જ ફેસિલિટી અત્યારે અવેલેબલ છે. કેરર્સ હોય સાથે તો કેરર્સને ખાસ જરૂરી છે કે કેરર બધી જ તમારી ડિસેબિલિટી કે જે કંઈ પ્રોબ્લેમ હોય એ બધા ઓપ્ટિશિયનને સમજાવી શકે. એટલે કોઈ પણ વસ્તુ ડિસેબિલિટી હોય કે ના હોય કે પણ જ્યારે બી તમે ઓપ્ટિશિયન પાસે જાઓ તો આ બધું લિસ્ટિંગ કરવાની ખાસ જરૂરિયાત એટલા માટે છે કે આખી એક્ઝામિનેશન જે પેલું થાય એ એકદમ સરળ થઈ જાય, બહુ સિમ્પલ થઈ જાય અને બધું અન્ડરસ્ટેન્ડિંગ તમારે અને ઓપ્ટિશિયન વચ્ચે એકદમ મેળ ખાઈ જાય. જયશ્રી.
Thank you. So what happens when you have an eye examination? Okay, so they will check the level of your vision. Okay, they'll check if you need glasses, and glasses can correct your vision, because sometimes, unfortunately, there may be a time when they cannot correct the vision. Okay, somebody may not be able to see all the way down the chart by putting the lenses in front of their eyes. So what they do is they check and see if spectacles or contact lenses will correct that vision. They look for signs of injury or disease or abnormalities in and around the area of the eyes and the eyes themselves. They will examine your retina, which is the little camera film at the back of your eye, okay, which interprets all the information. They would check the pressure inside your eye with a little puff test I was telling you about. And then your peripheral vision, the side-to-side vision, okay? Because all of this that they've done before is all to do with the central vision. So the side-to-side vision is checked as well if it's required. And they will talk to you about your age and what you're doing, your work, your lifestyle, and your medical history. Subhash?
આ એક્ઝામમાં કેટલા સ્ટેપ્સ હોય છે, અંદર શું જુએ છે? પહેલા તો આપણી દ્રષ્ટિ કેટલી છે કે એમાં પાવર છે કે 2 રીતે જુએ છે લોકો. એક તો એક મશીન છે જે તમને બેસાડીને તમારી આંખોમાં પેલું જોઈ અને એ મશીન કેલ્ક્યુલેટ કરે કે તમારી દ્રષ્ટિ કેવી છે, એક બીજી વસ્તુ. અને બીજી રીતે પેલા તમને બીજા ચશ્મા ઉપર મૂકી અને તમને
Oh, have we lost him?
I think so. Do you want to continue?
Okay.
Until we get him
Yeah,
back?
yeah, I can continue. Yeah, no worries. So we can come back to that. I'm not as good as him with the Gujarati, Bhavini, as you know. You and I both know, right? That's okay. No worries. So I'll try though. Should I try, Bhavini? Let's give it a go.
પ્રેશર બી મેજર કરે છે.
Oh, there you are. He's back. Are you there, Subhash?
My internet connection is
No,
very
you're fine
unstable.
now. You're fine.
Okay. Shall I do it? Repeat again?
No, you're from the look for the signs of injury. That's where you were.
Okay. અને કંઈ પણ ઇન્જરી બી થઈ હોય તે પણ જોઈ શકાય છે અંદર. અને પેરિફેરલ એક બીજો એ લોકો ટેસ્ટ કરે છે, વિઝનનો ટેસ્ટ કરે છે. એમાં આપણું વિઝન કેટલું શાર્પર છે, પેરિફેરલ વિઝન કે સેન્ટ્રલ વિઝન ગયું છે કે નહીં એ બધું અંદર જોઈ શકાય. એટલે બધા સ્ટેપ વાઇઝ કલાકની અંદર બધું જ જોઈ અને જો ચશ્માની જરૂર હોય તો ચશ્માની જરૂર, બીજી કંઈ પાછળ કંઈ એબનોર્માલિટીઝ લાઈક રેટિનામાં કંઈ ખામી દેખાય, એમને પ્રેશર ઓછું વધતું દેખાય, એ બધું કેલ્ક્યુલેટ કરી અને પછી આગળ એની સંભાળ કેવી રીતે કરવી એ થઈ શકે. જયશ્રી.
Thank you. So this is another infographic, and this one is called the eye test and who's entitled to a free eye examination under the NHS. People worry about costs, and so this is something we thought we'd make sure people know about. So it's recommended that everybody, including children, gets their eyes tested every 2 years. For children, it's a little bit more often because they're growing, unless you're advised otherwise by your optometrist. So if you are under 16, under 19 in full-time education, you would get a free eye examination under the NHS. Age 60, or if you're registered partially sighted or blind, if you have any diabetes or glaucoma, you're entitled to a free eye examination every year. Or if you're age 40 and you have a mother or a father or a sibling or a child that's been diagnosed with glaucoma, you also are entitled to a free eye examination under the NHS. Okay, if your doctor has advised that you might be at risk of glaucoma, you can also, book up for a free NHS eye examination. If you're a prisoner on leave, and the other thing to think about is people think about the cost of glasses. Okay, that's what stops people sometimes. They think, oh, I'll have to get expensive glasses, etc., etc. If you are on a low income, i.e., things like income support, income-related employment support, or in a job seekers allowance, or pension credit, universal credit, then you are also entitled to some help towards the cost of the glasses by the NHS. Subhash?
આઈ ટેસ્ટ ની પછી એલિજિબિલિટી શું થઈ શકે અને શું મળી શકે અને કોને માટે ફ્રી છે. એક તો ચિલ્ડ્રન એટલે બાળકો જે 16 વર્ષની અંદર હોય એ લોકોને એક્ઝામિનેશન ફ્રી છે. 19 વર્ષની નીચેના બાળકો જે લોકો ફૂલ ટાઈમ એજ્યુકેશનમાં છે એમને માટે ફ્રી છે. 60 વર્ષની ઉપર અને જો ડાયાબિટીસ કે ગ્લોકોમા કે કઈ રિલેટેડ બીજો કઈ પ્રોબ્લેમ હોય તો એને માટે બી આ એક્ઝામિનેશન ફ્રી છે. જે કુટુંબમાં ગ્લોકોમા હોય દાદા દાદીને પેરેન્ટ્સને કોઈને એ અને 40 વર્ષની એ કુટુંબમાં 40 વર્ષની ઉંમરના ઉપરને આ એક્ઝામિનેશન ફ્રી છે. એટલે ઘણી બધી વ્યવસ્થા આપણે અહીંયા કરેલી છે એલિજિબિલિટીમાં અને આ ખાસ ધ્યાનમાં રાખવાનું જરૂરી છે. એટલે પૈસા કે કોસ્ટ થશે કે મોંઘું પડશે એ ડરવાની કોઈ જરૂર નથી અને આઈ ટેસ્ટ કરાવવો બહુ અગત્યનો છે. જયશ્રી?
Yeah, so the NHS vouchers are available, like I said. So also ask about that, okay? If you're worried about the costs, see if you are eligible for NHS vouchers, things like pension credit and income support and job seekers allowance. Okay, next slide. So we talked about children, we talked about under 16s, we talked about under 19s, okay? And at the moment, for in the UK, for under 16-year-olds and under 19-year-olds in full-time education, the eye examination is free, okay? And with kids at the moment, there's a big worldwide problem, which is common amongst children that are growing, which is called myopia, which is short-sightedness, okay? That means that they can't see for distance very clearly. They have blurred vision. Now, if this is left uncorrected, there is a possible risk that the prescription will get stronger and stronger. And with that, the retina gets thinner and stretched. And that means in later life, people are living longer. Okay, generally our health is getting better and people are living longer. So in later life, they may have a possible risk of retinal detachment, cataract, or glaucoma. Okay, so it's really important that if one parent in the family is myopic or short-sighted, the child is 3 times more likely to become short-sighted or myopic. If both parents are myopic or short-sighted, then it's 6 times more likely that that child will have myopia. So it's really vital for children to have eye examinations, to have their eye tests and be monitored. And if mum and dad both wear glasses, even more so. Subhash?
એક તો કોવિડ અને લોકડાઉન નંબર 1 એક અને બાળકોમાં માયોપિયા એટલે શોર્ટ સાઇટેડનેસ બધું ઘણું ઇન્ટર રિલેટેડ થઈ ગયું અને વધારે પકડાવા માંડ્યું છે. અને અત્યારે તો આખી દુનિયામાં આ મોટામાં મોટો પ્રોબ્લેમ છે બાળકો માટે. હવે બાળકોમાં દ્રષ્ટિ એકચ્યુઅલી આંખો જેમ જેમ ગ્રો થતા જાય એ પ્રમાણે એમની આંખોની દ્રષ્ટિ પણ એ રીતે સેટલ થતી જાય. જો શોર્ટ સાઇટેડનેસ હોય બંને પેરેન્ટ્સમાં, એક પેરેન્ટમાં હોય મા બાપને માને હોય કે બાપને હોય, બરાબર, એમાં કોઈને પણ શોર્ટ સાઇટેડ હોય તો આ બાળકને શોર્ટ સાઇટ થવાના ચાન્સીસ વધારે છે. બીજું ઘણી વખતે તમે જોયું હશે કે અત્યારે બાળકો ટેબ્લેટ અને કોમ્પ્યુટર અને આઈફોન ને એટલું બધું નજીકથી ને કોન્સ્ટન્ટ જોયા કરે છે, એ પણ આંખોને સ્ટ્રેસ થાય છે. એ સ્ટ્રેસ બી હમણાં જ રિસર્ચમાં બી બતાવ્યું છે કે એ શોર્ટ સાઇટેડનેસને બી એક મોટું કારણ થઈ શકે છે. હવે આ બધી કન્ડિશન, આ બધું જો વ્યવસ્થિત રીતે તપાસ કરીને બાળકની દૃષ્ટિ ચેકઅપ કરે ના થાય અને જો એનો નંબર વધી જાય તો ફ્યુચરમાં જેમ જેમ ઉંમર વધતી જાય એમ ઘણા બધા જુદા જુદા જાતના પ્રોબ્લેમ થાય. એમાં AMD પણ થાય, ગ્લોકોમા પણ થાય વગેરે. 19 વર્ષના ને ફૂલ ટાઈમ એજ્યુકેશનના છે એ લોકોને પણ ખાસ કરીને આ ધ્યાન રાખવા જેવું છે, કારણ કે સ્ક્રીન ટાઈમ એટલો બધો વધી ગયો છે બધાનો, અને જેમ જેમ દ્રષ્ટિ ઓછી થાય અને વર્ષમાં જો ચેકઅપ ના કરાવે અને જો નંબર વધી જાય તો એ આગળ જતા મુશ્કેલી પેદા કરે છે. જયશ્રી.
Okay, so as Vash said, children are spending more and more time inside and not outside. So the important thing is to make sure that the eye examinations are done regularly. Encourage your kids to spend time outside where they're focusing at longer distances. Make sure they take regular near vision breaks, okay? And make sure that you visit the optometrist and talk about what they can do. Ultimately, glasses and contact lenses will be required, but there are new treatments available to help slow down the myopia, okay? And that could be contact lenses, specialist spectacle lenses and drops, but ask the optometrist first what the best option is, okay? Because children are visual learners. We actually had a situation where a parent brought their child for the first time to have their glasses, and the child was around about, I don't know, 6 or something like that. And I said to the lady, I said to the auntie, I said, oh, why did you bring your child to have the eye examination done today? And they said they were playing a game at school, okay? And she covered up one eye with her hand, and she said the teacher disappeared, okay? So basically, she's been using one eye to do all her schoolwork all this time. It's only because by chance that she discovered that she couldn't see when she covered one eye, that the teacher wasn't there, it wasn't very clear, she couldn't see the board or anything, that, you know, that she told her teacher, and the teacher told her mum to say, oh, go and get her eyes tested. So there used to be school screening. That isn't the case everywhere now. So it's really important that the parents actually take the time to do that. Subhash?
મેઇન તો ખાસ જોવાનું કે મા બાપને ખાસ ध्यान રાખવાનું કે બાળકની દ્રષ્ટિ પ્રોપર છે કે નહીં. એક જયશ્રી એક કેસ બી બતાવ્યો કે એક બાળક સ્કૂલમાં ગેમ્સ રમતા હતા, એ લોકો રમત રમતા હતા, એમાં આંખો કવર કરીને જોવાનું. તો એ બાળકે જોયું કે એક આંખ બંધ કરતું તો એને ટીચર એને બ્લેક બોર્ડે કશું દેખાતું નહોતું, એટલે એ બાળકને પછી એની માં એમને ઓપ્ટિશિયન પાસે લઈ આવી હતી. એટલે રેગ્યુલર આઈ ચેક કરવાનું અને ખાસ કરીને એટલું ધ્યાન રાખવાનું કે બાળકો દ્રષ્ટિથી જ બધું સમજી શકે છે ને આગળ એમનો જે પ્રોગ્રેસ, આગળ જે ભણવાનું, વાંચવાનું, લખવાનું, ઇન્ટેલિજન્સ બધું જ આંખો ઉપર ડિપેન્ડ થયેલું છે. એટલે બાળકોને વહેલી તકે આંખોની એક્ઝામિનેશન કરાવી, જો ખ્યાલ આવે કે કંઈક કશી તકલીફ લાગે છે અને બાળક કમ્પ્લેન કરે તો ખાસ કરીને આંખ એક્ઝામિનેશન કરાવવી બહુ જરૂરી છે. જયશ્રી.
Thank you. So what is a dispensing optician? That's what I am. I thought it was important to make a distinction. So the optometrist, okay, is the person that tests your eyes and looks at the back of your eyes, checks for all these conditions, and checks that the glasses, checks the prescription. A dispensing optician, which is what I do, is a person who is trained and qualified to offer the best advice on your frame and your lenses to suit your prescription and lifestyle. If the optometrist takes a long time to work out your prescription, the dispensing optician takes a good long time to make sure that the glasses are comfortable, that you can see clearly, they fit well, all of that. That's what a dispensing optician does. And they have specialties. And the reason I mention that is they have their specialty is fitting glasses to children because their faces are changing. They are also good at looking after people with visual impairment. They have the time to look at how they can help a person with that, and for dispensing contact lenses. And all that is carried out by dispensing opticians and optometrists who are registered with the GOC. Subhash?
ડિસ્પેન્સિંગ જ્યારે આપણે ઓપ્ટિશિયન પાસે જઈએ ત્યારે એ લોકો બધી જ બાબતમાં ટ્રેન થયેલા હોય છે. ચશ્મા કેવી રીતે ફિટ થાય, ચશ્મા પ્રોપરલી દેખાય અને પ્રિસ્ક્રિપ્શન કયું આપણને સુટેબલ થાય છે કે નહીં, એ બધું કાળજીપૂર્વક એ લોકો જોઈ અને તપાસ કરીને આપે છે. દેટ ઇઝ એટલે તમે જ્યારે ચશ્માની ઓપ્ટિશિયન પાસે જાઓ, ચશ્મા ઘરમાં જાઓ, ત્યારે એ જે તમારી સાથે બેસીને જે બધી સંભાળપૂર્વક બધી પ્રક્રિયાઓ જોઈ અને તમને જે પરફેક્ટલી સૂટ થતું હોય, જે તમને અનુકૂળ થતું હોય, એ તમને ચશ્મા અથવા તે સલાહ આપી શકે. જયશ્રી.
Okay, thanks. Okay, so I'm nearly at the end now, Bhavini. I'm nearly there. Okay, so the 3 C's of eyeglasses. What you have to think about, are your glasses current? Are you wearing the correct pair of glasses, basically? Are they current? Are they the most up-to-date pair? Are your glasses clean? Because lots of people don't clean their glasses very well. And are your glasses comfortable to wear? If your glasses are not comfortable, you won't wear them. Okay, so the 3 C's of eyeglasses: are your glasses current? Are your glasses clean? And are they comfortable to wear? So final slide for me here is basically talking about eye health. We need to think about eye health and think about the different lifestyle changes that we have. We've got smoking, but we need to cut down smoking because it increases the risk of cataracts and macular degeneration. We need to talk about exercise, making sure that we take regular exercise, looking after our eyes when we're talking about sunglasses and protecting ourselves from the sunlight, and making sure we have good quality sunglasses, and our diet, making sure we eat well and are healthy. And also that if you can't come for an eye examination to the optometrist, then they can come to you. You can have a domiciliary eye examination where somebody will come to you. Subhash?
આઈ હેલ્થ એટલે આ જે પોસ્ટર બતાવવામાં આવ્યું છે અને એ તમને અવેલેબલ બી થશે. જો એમાં ઘણી બધી વસ્તુઓ લખેલી છે. એક તો જે લોકો ઓપ્ટિશિયન પાસે જઈ ના શકે એમના માટે ઘરે આઈ એક્ઝામિનેશન સગવડ છે. સ્મોકિંગ એક બહુ જ મહત્વની વસ્તુ છે કે જે સ્મોકિંગ આપણી આંખોને ઇફેક્ટ કરે છે. ડાયટમાં બી બહુ જરૂરી છે કે બેલેન્સ ડાયટ બધું હોવું જોઈએ આપણું. એક્સરસાઇઝ, આઈ નો કે પેન્ડેમિકની અંદર આપણે એક્સરસાઇઝને બધો ભૂલી ગયા છે, પણ ઘરમાં ચાલવાનું, બહાર ગાર્ડનમાં ચાલવાનું ખાસ કરીને બહુ જરૂરી છે. આપણે નોર્ધન હેમિસ્ફિયરમાં ઉત્તરમાં રહીએ છીએ અને અહીંયા અલ્ટ્રાવાયોલેટ રેઝ વધારે હોય છે, જેથી કરીને સનગ્લાસીસ આપણા માટે બહુ જ જરૂરી છે. અને આ બધું જ ઇન્ફોર્મેશન જે છે એ તમારો ઓપ્ટોમેટ્રિસ્ટ તમને આપી શકે, તમારો ઓપ્ટિશિયન પણ આપી શકે. આપણે BAME અમારું જે અત્યારે જે વિઝન છે એમાંથી પણ મળી શકશે અને આ બધી જ ઇન્ફોર્મેશન તમને ડાઉનલોડ બી થઈ શકશે. જયશ્રી?
Yeah, one last thing, always make sure you wear safety glasses if you're doing any DIY or car maintenance or gardening tasks, so you don't get injury to your eye. That's the other one thing. And then I think we've done this bit, so we're on to this bit, Subhash, which is all about the pandemic and the problems with dry eyes. Over to you.
બહુ ટૂંકાણમાં પતાવીશ આને. આઈ વિલ જસ્ટ કે એક તો ઘરે બેસીને બધા આપણે કમ્પ્યુટર અને એની પર ખાસ પડતા કામ થઈ ગયા છે, વર્કિંગ ફ્રોમ હોમ, બરાબર. જોવામાં આવ્યું છે કે આપણું સ્ક્રીન ટાઈમ 11 કલાકથી વધુ વધી ગયો છે. સવારના ઉઠીને સીધો મોબાઈલ, રાતના સૂતા પહેલા મોબાઈલ, વચ્ચે કમ્પ્યુટરનું કામ, પછી આવે છે ટીવીનું કામ. અને આમાં મૂળ થયું છે શું કે આપણું જે બ્લિંકિંગ રિસ્પોન્સ છે, આપણી જે આંખો મચાઈએ છે એ બહુ જ ઓછી થઈ ગઈ છે અને આપણું ઇન્ટેક ઓફ વોટર, પાણી પીવાનું બી ઘણું બધું ઓછું થઈ ગયું છે. આ બધું કરી અને આ પેન્ડેમિકનો મોટામાં મોટો પ્રોબ્લેમ છે જે ડ્રાય આઈસ કહેવાય. હવે ડ્રાય આઈસ એક બહુ વિચિત્ર વસ્તુ કહેવાય, કારણ કે બધા મને કહે પણ ભાઈ મારી આંખમાંથી તો આટલું બધું પાણી નીકળે છે ને તમે ડ્રાય આઈસ કહી શકો. આ બધું ડ્રાય આઈસનું કારણ એક જ છે કે આંખોમાં જ્યારે આપણે વિચારીએ ત્યારે આખું એક જે ટીયર લેયર, જે આંસુનું લેયર આવે એ બેલેન્સ લેયર હોય છે અને ડ્રાય આઈસમાં એ બેલેન્સ લેયર ડિસ્ટર્બ થઈ જાય, એ સુકાઈ જાય, એટલે આંખો વધારે પડતું પાણી પ્રોડ્યુસ કરે છે જે ટીયર્સ કહેવાય. એટલે એ બેલેન્સ લાવવા માટે 2-3 વસ્તુ ખાસ જરૂરી છે. એક તો બ્લિંકિંગ નંબર 1, પાણી પીવાનું નંબર 2, અને જો આ કન્ટિન્યુઅસ જો આપણને બળતરા થતી હોય, આંખમાંથી પાણી નીકળતું હોય કોન્સ્ટન્ટલી, તો લુબ્રિકેટિંગ આઈ ડ્રોપ્સ, આર્ટિફિશિયલ ટીયર્સ આવે છે, પ્રિઝર્વેટિવ ફ્રી, એ ખાસ ધ્યાન રાખવાનું અને એ લેવા જોઈએ. જયશ્રી?
So many people are working from home, and this has led to increased screen time. On average, 11 hours is where we are, and that includes our smartphones, our computer usage, our TV. The pandemic has brought all of these problems. All of this results in a drop in the blink rate by more than 50%. And what happens is the eye has to compensate with that by making more tears. And this is a vicious circle. It goes round and round, and this can lead to dry eye. So you might feel that your eyes are burning or red. You've got watery eyes, inflammation of the eyes, and blurry vision. So, it's important that people actually take more water and blink a little more and use eye drops. Over to you, Subhash. Next slide.
Yeah, we did that. અને મેઇન તો ખાસ જોવાનું કે લુક અવે ફ્રોમ, જ્યારે કમ્પ્યુટર કે સ્ક્રીન ટાઈમ તમે યુઝ કરતા હો તો 20-20-20 નો એક છે આપણે રૂલ છે. એટલે 20 મિનિટ તમે કમ્પ્યુટર પર કે ટીવી તમારા એની પર કામ કરો. ઇવન ટીવી બી જોતા હો તો 20 મિનિટ તો તમે એક ધારું જોયા કરો. બ્લિંકિંગ, આંખ મીચાવવાનું ભૂલો નહીં. પછી 20 મીટર સુધી આંખ બીજી બાજુ કરી 20 મીટર દૂર સુધી જોઈ 20 સેકન્ડ માટે જુઓ. આથી શું થાય કે તમારી આંખોનું પેલું જે અંદરનું આપણે એને થોડી સાંત્વના પણ મળે અને દ્રષ્ટિ પાછી સ્ટેડી પણ થાય અને ડ્રાય આઈસ થોડી ઓછી થાય. નેક્સ્ટ જશે.
Eye hygiene.
Little high. Yeah.
Do you want to do the eye hygiene one,
Yeah.
Subhash?
Yeah,
English?
eye hygiene. હવે હું બધાને રિક્વેસ્ટ, shall I do it in English? Okay.
Yeah,
Okay, it's very important. Eye hygiene. ગુજરાતી અને ઇંગ્લિશમાં બંને કરીશ. એક તો જેટલી વાર તમે બાથરૂમમાં જાઓ, every time you go down to your washroom, please wash your eyes with lukewarm water or hot water which you can tolerate. Close your eyes and wipe your eyes from upwards downwards, paying attention to your eyelid margins. એટલે આંખોની જે પાપણો છે ને એની ઉપર ભાર નહીં દેવાનો, હલકા હાથે ધીરે ધીરે વોશ કરવાની. એથી કરીને આંખો ક્લિયર રહેશે. બ્લોકિંગ થયું હશે, ઇન્ફેક્શન થયું હોય તો એ ક્લિયર થશે. બીજું, પ્રિઝર્વેટિવ ફ્રી આઈ ડ્રોપ્સ મેં વાત કરી, લુબ્રિકેટિંગ આઈ ડ્રોપ્સ એ લેવા બહુ જરૂરી છે. અને બીજું એક તો આંખમાં જ્યારે આપણે દ્રષ્ટિ નાખીએ, જ્યારે આઈ ડ્રોપ નાખીએ, નેક્સ્ટ સ્લાઇડ પ્લીઝ, વેન વી પુટ ધ આઈ ડ્રોપ, તો ઘણી વખતે લાગ્યું કે આંખમાં જે લિક્વિડ હોય ને આપણે નાક થ્રુ ઘણી વખતે સ્વાદ આવે આપણા મોંમાં. એ કેમ થાય છે? આઈ ડ્રોપ આંખમાંથી એક નળી વાટે નાકની અંદર જાય છે. નહીં આપણે ઇમોશનલ થઈ જઈએ અને આંસુ આવે આપણને તો આપણે નાકમાં આપણે એ ખેંચીએ છીએ આપણે નાકમાં, એ નળી. એટલે આ દવા આંખો માટે છે, અંદર ના જવી જોઈએ. એટલે આ જે ફોટોગ્રાફમાં જે બતાવ્યું છે અહીંયા આગળ એને કહેવાય પંક્ટલ ઓક્લુઝન. એટલે ડ્રોપ નાખ્યા પછી આંખ બંધ કરી, મીચામાં જોરથી બંધ નહીં કરવાની, જેન્ટલી બંધ કરી અને ફિંગર ટીપથી આંખના ખૂણામાં નાકને ખૂણો અને આંખનો ખૂણો ત્યાં જેન્ટલી હલકે હાથે આંગળીથી દબાવવાની 1 મિનિટ માટે. તો પેલું જે લિક્વિડ આંખમાં છે એ નાકમાં નહીં જાય. નેક્સ્ટ.
And that's it, we're finished. Over to Bhavini. Now, Bhavini is the most important star of this show today, because Bhavini is actually going to share a very personal experience that she has about sight loss. Over to you, Bhavini.
Yeah, do you want to stop screen sharing? Yeah, okay. Thank you so much, Jayashree and Subhash Uncle, for that lovely, informative presentation. Just because of timing, I will share a very, very brief personal journey, and I know we've got a couple of questions and we also want to do some myth busting. So yeah, so basically I was diagnosed with retinitis pigmentosa. So, you know, I was a normal teenager. I could see really well as a child. But, you know, from the age of about, say, 15, 16, I guess, more so turning towards 17, I was finding it difficult to actually see in dim lighting. So when when you go to the cinema, perhaps, or to a restaurant, when they call it ambience lighting, and I was struggling to see in that. Or even in winter when it starts getting darker earlier, I was struggling to see, and the lighting from shops and cars sometimes wasn't enough. Forget nighttime, it was pitch black and I couldn't really see much at all. But then I couldn't also see in bright lighting. And I don't know what was going on. I was bumping into people, I was bumping into lampposts and just things that I don't know where they came from. I was missing steps, I was falling over quite a bit and tripping. Because of the age, and I was in college and it was close to exam period, I put it down to stress and thinking, okay, let the exams finish, I'm not sleeping enough, I'm overtired, hopefully it will get better. But it didn't. It continued. I continued doing clumsy things. I continued doing things that were making people stare and look at me, laugh at me sometimes, and it got to a point where I started worrying. So I did go to my optician appointment. They didn't really tell me much apart from we're going to refer you to your, to an eye clinic at an hospital. So, off we went. Me and my mom who really came to most of my appointments. And after about 9 months of testing, so, a lot of looking at the back of my eyes, a lot of field tests, looking at bright lights, they really wanted to know what was going on. And some of these tests actually, they are quite in depth, and you're there for, a few hours sometimes. And, after I think they had enough tests done, my mom and I were called into a room, and I was delivered the news that you've got retinitis pigmentosa. And I remember this day even now. It was a small room, it was quite dark, which was quite ironic, but I sat there and thinking, what's that? I've never heard of this. And all I remember is the consultant telling me that you've got retinitis pigmentosa. There's no cure, there's no treatment. You could lose your sight in a matter of years. It could be months, or it could be weeks. And I guess that was the biggest shock to me as a 17-year-old, being told that I would go blind. I hadn't even known anybody else that had lost their sight. I didn't know actually what that meant for me. All I knew is that I was supposed to go to university, and I was scared of being on my own, waking up perhaps one day and not being able to see. So that didn't happen. I didn't go to university. And what I did end up doing is staying in my bedroom for quite a long time, just trying to understand, trying to hope that they'll contact me to say that they've made a mistake, that they've got my records mixed up with somebody else, or just hope it would go away, And why I'm sharing this is because now that I know actually what should happen when somebody gets diagnosed with sight loss, or, any kind of condition, is they should be provided that information and make sure they've actually understood what that means. I should have got signposted to a local charity that supports people. I should have been referred to like an emotional support, like an ECLO, which is an eye clinic liaison officer. They're people that provide emotional, practical, and really useful support, and just sit down and ask, you can ask questions about, what you're thinking, what it means for you. But there was nothing. And that's just me thinking about myself. But actually, again, my mom that came with me to my appointments, what kind of support was there for her? She's just found out that her older daughter has been diagnosed with this condition and she's going to go blind. What support was there for her? And this is going back almost 25 years. So I guess you can say there weren't that many services or that many signposting available. But in the line of work that I do, and when I hear people who actually share what I went through in this day and age, actually, it, if I'm honest, disgusts me. It shocks me and it upsets me, because we've got so many important and vital services, but why are we not signposting? And I know that consultants are busy because they're trained clinically and they've got a job to do in delivering and testing eyes and delivering the news. But actually there's ways that could be done, and there's ways and things that are available in hospitals that they can signpost you to, so you don't get isolated, that you don't get lost in the system. There's rehab officers, and it took me almost, I think, 1997, I got diagnosed. And the first time I was in touch with a rehab officer was in 2010. That's how long it took. And the important services that a rehab officer provides to you to be independent, to help you get out and about, to help you support with cooking, just letting you know what kind of benefits could be entitled to you. There's so many things out there to help you live your life as a vision impaired person. But if you're not given that support, or if you're not told about them, then like me, I was basically left to go blind. And I know just because of timing, I won't go into too much, but at a future session, I will share more about how I managed to get the support I wanted, the different types of support I tapped into. For example, there's so many different charities that support you with cane training, alerting you, a rehab officer does that, and they're based in your local authority sensory department. So it's easier when you're registered. So we will do a session on what registering means. Once you're diagnosed with a sight condition, whether you're partially sighted or severely sight impaired, the fear of getting registered. So I was scared of being registered because I didn't want that label that I'm actually disabled or I'm blind. I was terrified about that because I didn't know what it would mean if others found out, especially as a young Asian girl in her 20s. And what would other people think? I was frightened. Like, we worry so much about what are they going to think? What is our extended family going to think? What is the community going to think? But that actually prohibits you from actually getting the support you need to live your life. They're not going to be there every single day for you. You need to do what's right for you. And it took me so long to get to that stage, to actually get where I am today, to get that mindset. Actually, I need to do what's best for me and my family. I didn't want to use the white cane because I was scared that everyone around me would find out that I'm actually going blind. I was terrified. And it took 2 incidents. One, actually, when I was picking my girls up from school, and I almost veered off. I was crossing a side road and I almost ventured out onto the main road, and a car had to stop and horn. And it took something like that for me to say, you know what? I don't care what other people think. I have to put our safety first. And then that is when I got in touch with my rehab and said, all those times you've tried to encourage me to use a white cane, I think I need to. So I started my training. But it didn't stop there. I was still scared of taking it to weddings, or I'm Gujarati, so at Navratri time or any Indian function, I still wasn't, because I was worried about what everybody else would think. Then it happened a few years ago where I was at my cousin's reception, and obviously receptions are dark, and I fell down these steps. And that's what it took, a moment like that. Everyone around me knew that I'm vision impaired, but why was I so scared of using a white cane publicly? And it caused an incident like that for me to be then able to use a white cane, because I said, you know what, those bruises are not worth it. And now, obviously, some of you may know that I've got a guide dog, so I do take my guide dog everywhere. And that's another story for another day. But, there are things out there that I've used that have helped me. And I think one thing I do want to say for anyone that is vision impaired and, thinking of volunteering or working, I was always led to believe that I won't be able to do anything. There wasn't any hope for me. How can blind people go to work? Who would employ someone that's blind or partially sighted? Until I started volunteering. And still, I started rebuilding myself, my confidence, my independence, and saw actually that there are loads of people, not enough, because we know that it's still a struggle and a challenge to get employed as a blind or partially sighted person. But there are many people who are out there working. And one thing I really would say and encourage is, if you can learn to touch type, that would really help. It would help because you get to use a computer, a laptop, and there are different softwares and different gadgets available. Please do check out websites like the RNIB or even our London Vision website, which has managing with sight loss courses, and it's got lots of resources on there to support you. But just things like touch typing and using voice over technology, your rehab officer will definitely be able to support you with things like that. And next time you're in a hospital, eye hospital, see if there's an ECLO, an eye clinic liaison officer there, who will also be able to provide you with so much useful information. So there's a lot I wanted to share and cover, that it can be isolating. Being vision impaired is an isolating time, because you're led to believe that once you're disabled or you have a disability, that actually you can't do much. But actually, in fact, we can. I mean, you heard from Saliha on Monday, she's living independently. She's working full time. Neeta Patel, you heard the amounts of stuff she's doing. Tomorrow we'll hear from Maxine and Ifsal on Sunday about the various things that are possible for visually impaired people, all from our communities, who are proving that actually, we need to break down these barriers. We need to change the perception of sight loss to what it is. And through BAME Vision, that is exactly what we want to do. And I'll lead on to the next bit, which is I was desperate at the beginning when I didn't know what retinitis pigmentosa meant for me. And when I heard these so-called cures, I was told that, put coriander juice in your eyes, like drops of coriander juice, and that would cure my blindness. I was desperate. And shamefully, I would admit, I did try it. It didn't work. But by doing these talks on various radio stations and going into different community groups, we've actually heard about different things that other people have heard, and we'll share them, because we don't want your sight to get worse than it is. Some of them are harmful, some of them are dangerous, and some of them can actually lead to sight loss, even if you may not have sight loss and have something quite minor. So Subhashankar, do you want to cover what you have heard? And I'm happy to chip in when we,
Sure.
I think of some.
Right. My area of work has been into eye drops since last about 15 years now. And since last about 10 years, I have been into interaction with quite a number of communities. East African, I'm from East Africa. I speak Swahili very fluently. And so there has been a huge amount of information which we have gathered. One thing is that do not play mischief with your eye, number one. As Bhavini just now said about this coriander juice and khakra noak, there is an extraction of a vegetable root which is very prevalent in India. Also, there are some Ayurvedic or a Unani medicines, eye drop medicines, which are being prepared, which has got no actually scientific reason behind it, but it has been traditionally which has been given. I've come across people from Africa putting goat's blood in their eyes. So all these things are very harmful to the eye. Surface of the eye is a very delicate structure. So it is very important to know, only put those eye drops which are preservative free, number one. Second thing is, the only medication which has been prescribed by your ophthalmologist, by your doctor. And I have stood before audiences, and I've actually with folded hands, I've always requested people not to go fall into these traps. And please, for God's sake, Dr. Google is not a very good source of getting your eye drops, number one. Second thing is, please don't follow WhatsApp. There's lots and lots of things which has been going on WhatsApp since the pandemic has hit. And I have been actually reading through some of the most dangerous things which has been promoted. For example, like I came across, a friend wrote to me from India, oh, if you put your early morning sputum, really? To take a sputum out of your mouth over the whole night where the bacteria has flourished, and you put your eye to remove your cataract, doesn't happen. It actually gives an infection of the eye, which is very difficult to cure sometimes. And this is what we are trying to give a message in our this program, which Bhavini and the team has really organized it extremely well. But later on that, this information will be available to you even after the National Eye Health Week is over. So if you've got any questions in future or now, please send it to Bhavini, and we will be able to address it very comfortably, because we've got a huge number of consultants, really good ophthalmic consultants with us, who are always ready to help and assure you about differentiation in medication, in the process of ophthalmic operations, cataract removal, etc., etc. Bhavini?
Yeah, I've just had a question come in, and it's asking about ginger juice. Your ginger juice.
This always surprises me, you know. It is one of the most dangerous thing. You cannot put a ginger juice. I know there is one Ayurvedic medicine which is very cheap, which is available in India called Drishti by Baba Ramdev. It is one of the most dangerous thing which you can ever put in your eye. It has got extract of onion, of ginger, of lemon juice, of benzalkonium chloride, and as well as honey. Doesn't work. Believe me, it doesn't work. What it does, it irritates your eyes so much that it becomes dry and your eyes start watering profusely. You get an inflammation of the eye, and people think, oh, because it taking out all the dirt which is in the eye. It is not that. It is your body's reaction to that. Please do not put ginger juice or any juice in your eyes.
No, I think just seek advice from your consultant, because they're the best. They're medically trained, and they will be able to advise what you can and cannot put in your eyes. You know, only put in drops that are medically prescribed to you, please. Sorry for running over time, but just want to open it up to any questions and answers. If there are any questions in the chat, Prabhat. I know, is it Pratak that had his hand up? Was that because of a question?
Bhavini,
Uh-huh.
I have seen 4 questions which I can answer right now, one by
Yes,
one.
sure, please.
Okay, I'll make it very, very short.
Okay.
First of all, this first question is that if a grandparent has got glaucoma and if you are over 40, are you entitled for a free eye check? Yes. Okay. Blood can be measured at home using a monitor. What can we do at home to give an indication? Okay. You cannot measure your eye pressure at home. There is nothing available at the moment. However, there is a certain research which has been going on, which you can put it in the eye, and it is related to an app, but it is under control and it has to be done from the hospital. But there is nothing which is available which you can use as a monitor of your eye. For this type of questions, I would always recommend go for your optician eye check every year. And if you're on any medication and all, whenever your appointment comes through, please go and check it, and doctor will be able to see whether your pressure is under control or not. For pressure control, I will always recommend, if you put your eye drops at the correct time, remember, correct time, correctly. And believe you me, your pressure will be under control. Another one is question is any information related to rheumatoid arthritis? Yes, we had this question addressed day before yesterday. People with rheumatoid arthritis, or it is a collagen disease, it's an endocrinal disease, and hydroxychloroquine is one of the medication which is being used. Now, hydroxychloroquine actually affects also the retina, so that has to be properly it should be properly monitored, the dosage and everything. So your consultant will actually look at every time you go down. Your consultant will be also consultant will be looking at your eye as well. There's another question which said
vascularitis with eye health.
Yeah, arthritis and eye health. Yes, if you have arthritis and you are on anti-inflammatory medication, it is very important that you get your eyes checked every year, and your rheumatoid specialist will be able to actually recommend you to the eye specialist in that particular hospital. So it is very essential that you monitor your not only your inflammation of the rheumatoid arthritis, but also you manage your eye situation as well.
Yeah, and I'll take the next one, Sebastian, which is vascularitis with eye health. Vascularitis means that basically inflammation of the blood vessels. Okay, that's what that means. And so obviously that can affect lots of different things in your eyes. But one important thing to think about is giant cell arteritis, which is basically, it's a type of arteritis that affects your neck and your head. Okay, and it's common in adults over the age of 50. It's sometimes called temporal arteritis, and it can cause like an aching or a soreness around the temples. You sometimes have jaw pain while you're eating, or headaches, or double vision. And the important thing is obviously to go straight away, if you get anything like that, to your optometrist and make sure that they know about it. It's important to make sure that you go for regular eye examinations. And I think there's more information on the NHS website. I can put the vasculitis.org.uk website details if you want that, if that's useful.
Yeah.
There's one more thing. I know time is short, but would love to hear about your guide dog and how it has been received in your Gujarati community, Bhavini.
Yeah, you know what, actually it's been mixed. So when I got matched up with my guide dog, I did lots of Facebook live videos of us doing our training. So like, you know, messages around how me and my guide dog work, not to distract him when he's working, not to feed him, but how the training actually works. And a lot of people who tuned into them actually, you know, were really well educated afterwards. So it was nice when, so where I, you know, my community where I go like for functions and Navratri, actually, we were welcomed with open arms. Like, you know, I was specifically told that please do bring him. My guide dog's a boy, and, you know, please do bring him. And it was lovely. So he has attended weddings and he's attended functions with me. Some they have been quite challenging because I think awareness around what a guide dog is, and, you know, they're completely different to normal dogs. The training they go in, people have a perception that they're dirty or they're not going to be well behaved. But I think, you know, more work needs to be done. I mean, just recently I had a family wedding, so I had to go Indian shops to do like sari shopping, jewelry shopping. And, you know, I will mention, because I think it's good, you know, Ealing Road, I went to Krishna's, and what was the other one, Vanilla, I think it was, you know, to do shopping. And we were prepared to say that, okay, my husband's gonna have to stand outside with the dog and I'm gonna have to go in and, you know, struggle to see what matches. But actually we went in, and both shops, both members of staff asked if I needed any help, which was really lovely. I said, yeah, I'm looking for this, I'm looking for that, I want to match this, and they were perfectly fine. So, but there's been some areas where it's not been that welcoming. So, you know, this is something we're going to work on through BAME Vision as well, just raising awareness of guide dogs. So it's been mixture, good and bad, but I think the bad is, you know, something we need to do in raising awareness. But thank you for asking.
No, that's okay. That was pretty you asked that. So hopefully, I think that's all the questions covered as far as I can see. Prabhat, is that right or not? Have I missed anything?
As far as I can see, there was one hand went up a little earlier.
Right.
Yeah, I think it was Pratak, wasn't it? Pratak, are you still with us? And do you want to unmute perhaps? I think he's gone. Okay. Just gonna check. No, so that's it. Just a message to say excellent, well done.
Okay.
So
apologies if we've overrun, guys. Hey,
yeah, really sorry about that. And, you know, but thank you for sticking with us. Thank you for sharing, and thank you for your questions, because this is why we're doing these sessions, you know, an opportunity for you guys to learn and ask your questions as well. Very quickly, tomorrow's session is in the afternoon at 2 o'clock, 2 to 3, and we are focusing on mental health awareness. How, you know, the people with risk of sight loss and those who are vision impaired, you know, partially sighted or severely sight impaired, how mental health can be affected, because, you know, I've just really briefly said that sight loss can be isolating, you know, full of anxiety about going out, you know, just worries about the future. So we'll be talking about, you know, mindfulness practice. If you've never done mindfulness before, you're in for a treat, because we will get a demonstration and you can do it in the comfort of your own home. And it's just ways to just sort of take some time out, and why it's so important to relax and breathe, especially, you know, we hear it for our bodies all the time, but actually for our eyes as well. And we'll also hear from Wayne Chapman, who is a mental health and awareness coach for seeability. So we'll learn more about seeability and hear from Maxine, and she'll be talking about living with cholera-boma. I hope I've said that correctly. So tomorrow's session's 2 to 3 p.m. And then our last session is on Sunday between 1 and 2 p.m. And we'll be really focusing on dry eyes. So we touched upon it today, but we have an expert in dry eyes, and we'll be talking more about glaucoma and eye drops, and we'll be hearing from Ifsal Khan. And another opportunity at both sessions to get your questions over to us. So thank you for bearing with us, and I hope you can join us tomorrow.
And remember
Bye
to
now.
give us lots of feedback. That will be very important.
Yeah, if you're able
Absolutely.
to share feedback, apart from you guys
You've done-
overrun.
Yes, what is good or what is bad.
Sorry, I'll come back again. Up here.
Oh, hello.
Hello. My question is, I read it somewhere in the hospital, one of the boards up on the wall, that COVID-19, the virus, it can enter our body through the corners of the eyes. Now, is that true or not?
Interesting question. I think the important thing to remember is that you want to make sure, this is why we're still in practice, we're still carrying on wearing our masks, we're still wearing our shields, we're still wearing our disposable aprons.
Yeah.
And we want to make sure that, you know, we make sure that that doesn't happen. But important, there's a lot of research going on around that. That's all I can say at the moment, if I'm being honest. A virus can enter anywhere in the body. That's the important thing to remember. And to be sure that you look after things. People should clean their glasses. I'm amazed with the number of people that don't clean their glasses and all the sort of stuff and muck and things that are on their glasses.
Yeah, they got into bad habits. That's what it is.
Yeah, absolutely. Go on, Subhash.
Main thing is
Yeah, but
washing, sanitizing your hands,
Hands,
washing your
yeah.
hands.
Yes.
And remember, if you've been out and about, please do not touch your eyes with your fingers.
Yes.
Because I've noticed it when you go out and you've got these runny eyes or the dry eyes which you get, and people tend to, touch their eyes and clean it. Don't do it. That is where the virus can get in through the scleral.
Sure, but what if you carry a hand sanitizer?
Great.
Hand sanitizer, great.
Great.
That's a good
Great.
idea.
You all the time, and you
All the
keep
time.
wiping your fingers and all that with it.
Yes.
The important thing is
Brilliant.
to maintain all the stuff we've done before. We should now be changing our habits, really. That's the important thing.
Exactly. Sure.
This virus is here to stay in one way, shape or form, and many viruses before, who knows? But the important lessons we've learned now are to always wash our hands when we come home, make sure we don't keep, people do touch their hands and their faces and all that a lot as well. So be mindful of things like that, be careful about things like that. And also, like you say, like clean surfaces at home, you should clean your glasses as well.
Sure. No problem there. But as I said, is there anything that we can do to protect the eyes from COVID entering through the corners?
Main thing, if you're wearing glasses, that's number one.
That's
Second
one
thing,
thing,
as
yeah.
Jayshree said, keep the sanitizer. I'll tell you what. We have got a sanitizer bottle just near our door. We have got two bottles in both the cars. I also carry a small sanitizer bottle in my pocket when I'm going out and about.
That's what
I go cycling early in the morning. I'm all alone by myself, and yet, when I come back home, I still sanitize my hand. So you got to be very, very careful about this.
Of course. No, but what I mean is like the eyes, especially corners. Let's put the ends of the eyes by the nose. The skin there is sort of bare.
Yeah.
Now COVID can enter through there without warning. But is there anything to prevent it?
Not to my knowledge, straight off like that. No. The important thing is to do all the things we've said. Really, to my knowledge, I can't say one thing. Or if you do this, you won't get it, because that's not possible, really. So that's important to remember.
Of course, yeah.
So
All right. And sore eyes can be, an ocular symptom in COVID-19. People do get sore eyes sometimes with COVID-19. So again, you've got to be mindful of these things. What you have to do is do the best sort of care in terms of what you can do, at the end of the day. There's nothing specific that I can think of off the top of my head. I'll look into it a little bit more and come back. How's that?
Thank
No,
you.
thank you very much for that. Yeah, that's
Before we leave, before we say goodbye, just giving a chance to anyone. Any last questions before we go?
I think we're clear by the look of it. It says thank you for a very informative session. Lots of positive comments here, Bhavini.
Oh, thank you.
Thank you.
Thank you so
Thank
much.
you very much.
Your comments
No
and
worries.
Very
feedback
interesting,
to
very
me.
helpful.
Thank you.
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 Thanks a lot.
Thank you very much.
See you all tomorrow.
Yeah,
Bye
see you.
now.
Tomorrow. Bye bye.
Bye-bye. Bye.
Goodbye.